I'm excited to talk today about if an acupuncturist should study and learn Chinese herbs or not. It was so interesting when you and I were emailing about this because we just had like totally different ideas on it. And I just posted a couple posts this week that saying we were going to talk, and it was actually interesting because people also have different ideas on it. So in a nutshell, like, I think that like everybody should learn herbs, and you said that you think that they should not. So how about we start with you like, with you like sharing what your thoughts were on it that you were sharing with me. And then I can like dialogue back on that, and then we can just free flow and talk about that. And and this too, a lot of acupuncturists do ask me, because a lot of schools you can choose, if you want to do herbs or not. The schools that I went to, you don't choose. I think in California you can't choose. It's just part of the program. But a lot of schools you choose. So people don't know what to do because it's more time and it's more money. And more brain power, of course.
Absolutely, yeah.
Yeah.
Well, you know me, Alyssa, I have opinions about everything, and if I start telling my opinions, I'll probably just go on and on and on. But so let me just start and then just cut in.
Yeah, okay. Yeah, I will.
So I think I'll start with two things. First of all, when I was first in China, which was in 1981, working in a hospital.
Wow.
There was the herbal medicine department and there was the acupuncture department. Mm-hmm. The acupuncturist did not do herbs, and the herbalist did not do acupuncture.
Oh.
I mean, the acupuncturist might occasionally rather tentatively prescribe patent remedies, but that was as far as they went.
Yep.
So it was very clear to me there were two branches of the profession. It was the herbal medicine branch.
Yeah, that's very interesting.
That's one thing. Now, the second thing is...
do you know, do they still do that in the hospitals there today?
I'm out of touch. I don't know. It's quite possible things have changed, but whether they've changed for inherently good reasons or whether they've changed for commercial reasons...
Yeah, we don't know.
I really don't want to speak about that.
Yeah.
But what I would say is, the second thing I wanted to mention to kick off the discussion was the conversation I remember having a long time ago with Julian Scott. Julian Scott was a colleague, friend, specialised in treatment of children by acupuncture. I don't know if you know him.
No, I mean, maybe. It sounds maybe familiar.
I mean, he really established the profession of paediatric acupuncture in the West.
I love it.
So he was pointing out to me that in Western medicine, it's well understood that you have different personality types going to different branches of medicine. Mm-hmm. So you have the surgeons who are not great thinkers. They're not the intellectuals. Uh-huh. They're not the ones who sit and make subtle diagnoses or even what their manual. They play rugby, or the equivalent perhaps would be American football, and they just want to get their knife out and start cutting. That's their thing. They don't particularly want to talk to patients, just like, hi, I'm your surgeon, I'm going to cut your appendix out, goodbye. See you after the operation.
Yeah, it's real.
So they're dynamic doers, action people, action men and women. And then you have the GPs, and especially the traditional GP, a bit less so nowadays, is the one who really knows people, really talks to people, really understands, asks lots of questions, has to make a real diagnosis of disease. Mm-hmm. So he said, well, of course, this is human medicine, human nature. You have the same thing in Chinese medicine. Mm-hmm. You have the acupuncturists who, while we have been taught in modern times to try and make complex diagnoses, there's a certain element of the acupuncturist that kind of just wants to get in and start sticking needles in, and that's reflected.
Me.
It's reflected by a lot of the modern acupuncture techniques, the Dr. Yuan and Dr. Tan system. It's not a deep
Yeah.
diagnosis. It's kind of palpation. Where does it hurt? Bang, bang, bang. Needles. You know?
Oh yeah, not quite that, but I'm more like, I'm gonna learn by doing it, you know?
Yeah, that's the surgeon part.
Yeah.
Whereas herbalists have to, my goodness, have to think. Starting with studying, which I would say is, in my experience, 5 times harder than learning acupuncture.
What is herbs is 5 times harder?
Studying herbs, 5 or 10 times harder than studying acupuncture. If you do it properly.
Very different. Yeah, it's so different with all the different tastes and temperatures, and then the combinations, and like there's so many different factors, the contraindications, you know, like. So yes, I would agree. It was a real process to learn how to learn them.
Yeah. And the stakes are higher. I mean, having learned all that, you have to make an accurate diagnosis and you have to prescribe correctly. If you don't, your medicine is either ineffective or it can be harmful. You know, you took hot herbs to a patient who's already has heat, even maybe hidden heat, or you tonify too much when there's already the presence of excess pathogens inside the body and so on. So you can really get it wrong. Acupuncture, unless you stick a needle in somebody's lung, you can't get acupuncture wrong. You know, everybody gets some benefit. They lie on the couch, they get some general benefit from the experience from needling. It's so you can get away with it. That's why there's 10 million stars of acupuncture. They're all, you know, go, great, this works. You know, it's very, very, very forgiving and very flexible.
Yeah, it is.
You know, and herbal medicine isn't. So that's
yeah. I mean, I think though that like there really is just one main thing, and it's like, you know, don't give a hot person hot herbs. Don't give a cold person cold herbs. You know, and I think that I agree with that, but it's also, it depends on what you're treating and what type of herbs you're using, of course, you know, but there are a lot of herbs that are still very subtle, you know, just subtly tonifying blood or this or that. And I feel like there are still a lot of herbs that are, you know, kind of like acupuncture where you kind of can't go wrong with giving them to your patient.
That is setting the bar very, very low. It's like, oh yeah, you know, I'm a herbalist and my main priority is to give such
but it's a starting point for a lot of practitioners who, let's say, want to learn herbs, but, you know, are really scared, you know, and hesitant. So, you know, because we come from, you know, I'm the like cheerleader for the, you know, for the acupuncturists who are like, don't have confidence and like want to be great, but like are a little hesitant and scared. So I, of course, have that mindset and outlook on it. And so, you know, it's the same thing. I feel like when I talk to them about herbs, you know, a lot like that of, you know, like you can start there, you know, to build confidence, to learn the herbs more, to, you know, get used to prescribing them, get used to seeing the effects of your, of the herbs on the patients. Oh, somebody said, can you see the chat over here on the side? You can put the chat open. It's like the little second bubble down if you press it.
On the right-hand side, all messages are public.
Yeah. There's a little, the first thing is a gear in the blue line, and then the second thing is like a talking bubble. Press the talking bubble.
Okay. Yeah, I can see it now.
Yeah. So somebody said, Matt, he said, I inspired them to go back to university and study herbs, and now they're halfway through their Masters of Chinese Herbs in Melbourne, and it's amazing and feels so different than just doing acupuncture.
Okay, so but maybe I need to clarify. I'm not in any way suggesting that acupuncturists shouldn't study herbs.
Yeah.
You know, absolutely, of course. If you're drawn to study herbs and you're willing to take on, you know, the mountain, and you're sincere and you study and study and study, and you know, absolutely brilliant. But that's not the same as saying all acupuncturists need to study herbs. It's a completely different thing. And so there's so many issues here. I mean, one of them is, okay, shall I say?
Oh, yes, go for it, yeah.
So I think one of them. So two things is what are the limits of our medicine, and what are the limits of acupuncture, and what are the limits of herbal medicine, and the other is. So in Chinese medicine, I learned a lot when I was in China first time, and we used to go to sometimes go and look at the Qigong clinic. Sorry, at the Twin clinic, and you had these really strong people with lots of Qigong, maybe did martial arts, who were laying patients down. Often it was winters. The patients often had great thick clothing, 5, 6, 7 layers of clothing, some of it padded because nothing was heated, and they massaged them through their clothing. They were hard, they were tough, they had these really strong hands, and they had these calluses on their knuckles from so much rolling technique. Their approach to medicine, they were hands-on, they palpated, their treatment was physical, manual. So you could put that at one end of the spectrum of Chinese medicine. They were in traditional terms, they were lower class. They were the lowest class because they were physical. They touched patients. So right at the other end of the spectrum, you have the herbalists, the intellectuals.
Yeah.
Their interaction with the patient is through talking. Most talk, ask, reflect, tongue, pulse, think, come up with a prescription. Has to be elegant, has to be precise, has to be effective. In the old days, the patient might go to 5 herbalists, get 5 prescriptions, and only take the one they liked.
Really?
Yeah.
The patient would decide which one they like?
Yeah, that's another subject, but it was a thing. So you've got these two ends of the spectrum: the intellectuals and the manual labourers, if you like. And then the question is, where does acupuncture lie along that spectrum? So some people would say acupuncture actually lies more towards the physical medicine end. They emphasize diagnosis by palpation. They emphasize really effective needle techniques, strong manual needle techniques, and perhaps de-emphasize. They say, oh no, all this differentiation of patterns, that's just the herbalists and so on. So there is that branch, and then you get the other trend, which is no, acupuncture more like herbalists with lots of careful diagnosis and thinking. So that is one question. What is acupuncture? Where does it lie along that spectrum? The second question is, do we have to try and be good at everything?
That's a great question, and I would say no.
So my favorite ever singer in the world, Bob Dylan, who, a bit like Shakespeare, came up with little phrases that seem to apply. So he said, tell me where it hurts, and I'll tell you who to call. So, I don't think we are, for example, I don't think we're psychotherapists. I think a lot of acupuncturists particularly think that therapists. We're not psychotherapists. There's a limit to what we can do.
It's so hard not to bring that talk therapy into the interviews with people a lot of times. Not so hard, but a lot of people, it depends on the practitioner. It depends on what you allow in your treatment room. As somebody like me who's chatty and open and, happy, of course I had a lot of that come into my treatment room, and I had to learn how to have healthy boundaries with that and how to, sometimes cut the patient off and that type of stuff, So, but yes.
So I'm not, again, to clarify, I'm not in any way suggesting that practitioners shouldn't communicate with patients on the level of their emotions and everything. But first of all, if you're not trained in counselling or therapy, beware where you go. And secondly, they're kind of contradictory opposites, because the diagnosis and treatment model of psychiatry, was bypassed. I mean, all right, it still happens in medical psychiatry, but the whole person-centered therapy movement from the 60s onwards was you don't instruct patients, you don't advise patients, you don't treat them. You slowly, with great skill, facilitate them to come to realizations of themselves. That's a completely different skill. So, I would say, great, of course, absolutely. Discussion of people's emotional and psychological states fundamental to diagnosis, but there is a limit. We're not psychotherapists. So I think acupuncturists also have to accept we're not dermatologists. We're probably not great at treating autoimmune disease. We are limited in gynecology and infertility. A lot of complex. It's very hard to treat chronic severe blood stasis with acupuncture. There's a limit to our treatment, I think. We're very limited in our treatment of cancer. I think herbalists have much more capacity to treat cancer. So
you mean just acupuncture with all those examples? Yeah.
The point is there's nothing wrong with that, because at the same time, acupuncture's got things that's really very effective for, and maybe more effective than herbal medicine. It's very direct, it's very rapid. You can relieve pain in 10 minutes with acupuncture. You can't do that with herbs, And so, I mean, I don't know how it is for most practitioners. I would say broadly, I think in many people's practices, 60-70% of the patients come with musculoskeletal problems and pain. Would you agree with that?
Yeah, I would say. I mean, and whether that's what their chief complaint is or not, for sure, people have pain everywhere all the time. Yeah. I would definitely agree.
A lot of musculoskeletal diseases. So, I would say, for example, before an acupuncturist embarks on the climbing the mountain and studying herbs, they could ask themselves, have I explored the potential of acupuncture to treat the patients who do come into my clinic for acupuncture? Have I really fully explored it? How knowledgeable and competent am I with musculoskeletal diseases? I'd say most acupuncturists aren't. I wasn't.
I mean, it takes years of experience, really, to understand how to treat that stuff.
And study, I mean, a patient comes in with shoulder pain. If they go to a physiotherapist, the first thing a physiotherapist will do is make a differential diagnosis. What's going on? Shoulder, is it shoulder impingement syndrome? Is it whatever? Is it? How many acupuncturists can do that? How many acupuncturists know the natural progression of that disease? I mean, if you don't know that frozen shoulder untreated takes 18 months to treat, to recover, and you treat for 3 months and you get 70% improvement, that's actually a good result. And if you don't know it takes that long, you might think it's effective.
And I actually did have that almost exact same thing happen in my practice. I mean, she got so much better, but it was just still a little stuck, for months. She was a regular patient of mine, though, so we just kept treating her. But I knew that frozen shoulder can take a massively long time. But honestly, probably because I Googled it, not because I learned it in school or anything, and if I did, I probably didn't remember, honestly,
So my point would really be, first of all, let's try and think, what is acupuncture really good at? And if you're an acupuncturist and you love acupuncture, instead of feeling guilty or feeling pushed to study herbs or feeling somehow you're inadequate, you just really study what would significantly improve your acupuncture and recognize your limits. Every medicine, every branch of medicine has some things it can do really well and some things it can't do well. And that's the fact of life. We are rather, I think one of the worst things is acupuncturists are misinformed when they study acupuncture. Oh yeah, acupuncture treats the person, therefore it treats everything. It's not true. It really isn't true. It would be ridiculous to expect to do that. Why would you have any other form of medicine in the world? So, we shouldn't be deluded. We should accept limitations, and then we should really master our art. The art, if you want to be an acupuncturist, master the art of acupuncture. And nowadays, that means studying probably quite a lot of stuff they don't spend enough time at school studying, like sports medicine and musculoskeletal diseases for that big batch of patients who come in with those kind of problems.
Yeah. Yeah, I mean, I definitely hear you, what you say. And I don't completely align, because I am more of like a just get in there and start treating patients and get the experience and don't study too much, because of what I see with acupuncturists is they study and then they have that inferiority complex. It, ruins their confidence. They feel like they're not good enough, like they don't understand that, like they'll never get there. So I, encourage people and practitioners and myself to just get in there and treat patients and learn and touch and be present, and see the results you get, because you will always help someone, of course, when you're treating someone. But like you said, there is a lack of awareness of to what point can we help someone, and when people don't get them all the way, then they feel like a failure, when that's not true at all. It's just the way that our medicine works, which people don't understand that, for sure. For sure. And then I think, I think you make a really valid point that, I mean, only really if someone really wants to learn herbs to go for it. But I feel like a lot of them are hesitant just because, again, of lack of confidence. There's a lot of lack of confidence out there with the newbie acupuncturists. And I feel like if someone is in that position, the herbs are really amazing. And even if you learn the herbs and you are only using patents, even just some blood building patents for your menstruation patients, the herbs are amazing, and so I encourage acupuncturists, if you feel like, and if you're drawn to it, then definitely go and study it, even if you're not going to become like a super expert in the herbs, because yes, the herbs are extremely challenging, like extremely challenging. And really, though, only with time and continuing to learn them and continuing to use them will anybody get any better at doing it. Avoiding something, of course, is not going to help anyone to get over their lack of confidence, or get over just not even understanding what's happening.
But okay, can I just start in and say?
Yeah, that's why we're chatting.
I know your big thing is lack of confidence. You talk about it a lot.
Yeah, there's a lot of that.
The problem is that lack of confidence can come from, feelings of not having self-worth.
Yes.
All kinds of negative stuff. But sometimes it comes from the fact that the actual fact is you don't know enough, and you should lack confidence. I mean, I'd rather somebody had a kind of authentic lack of confidence than had false confidence. I mean, the world is, particularly, I just mentioned, we've got, this, just had this terrible, from my point of view, election result in Britain. We have yet again, we have another upper class, private school educated kid manifesting as a man, who's our new prime minister. And the characteristic of these people has been, they've kind of run Britain for years, is have an absolutely false sense of their own brilliance, because they were born into certain segment of society. They went to these schools that told them, you are the leaders of the world. And they're often really dumb, So
but they have confidence.
They do not lack self-confidence. So I don't, I think we have to, there's self-confidence that comes from blind ignorance.
Yeah.
And there's self-confidence that comes from really authentic connection and knowledge. And we've got to be careful to distinguish between the two. So just going back to...
Go ahead.
Well, your previous point, I think patent remedies is absolutely a middle way. I think that's a valuable step that practitioners can take. Although it's worth remembering that, I mean, most patent remedies are prescribed at ridiculously low doses. I mean, if you look at, he was a colleague and a friend of mine, Giovanni Macioccia, but if you look at his three treasures, when you calculate the dosage of herbs that people are taking, it's minuscule. And, it has some capacity to do good and very little capacity to do harm. But it's not really herbal medicine. But okay, patent herbal remedies can be important and can be valuable and great to do them. But I think beyond that, if you're going to study herbs, you have to recognise there is no lightweight, in my opinion, there is no valid lightweight practice herbal medicine beyond patents. You either really grasp the nettle, put in the ears, it's a struggle. I mean, I'm quite a self-confident person, and I consider I have quite a good brain. Always found studying pretty easy. I found studying herbs really, really, really hard. And I gave up practicing herbal medicine when I stopped practicing. I gave up with feeling I really had not mastered it.
Wow.
So I think the bar for being a real solid practitioner of herbal medicine is very high. And it's really important to know that. And if, to pretend that it's just a hill rather than not even a mountain, but a whole series of mountains, is to go into it with completely the wrong idea.
Well, me with my enthusiastic American attitude, I say that sounds like a good challenge.
Yeah, wonderful if people do it, wonderful. But not easy.
No, and definitely, I agree. I will 100% admit that in my practice, I went more towards the patents. Because there was a patent out there for everything. It was much simpler for me, much quicker for me, and I did mega up the doses for people. I actually got higher patient compliance too, with patents and pills than herbs. People are just love taking the pills, so I also went towards patents for that reason, because I started to ask my patients, what form would this be the most, would you take this in the most regularly? And everybody was always just like, pills, because I can just, put it in my purse or whatever.
Okay.
But for sure, that's not, I agree. It's not really being an herbalist. I'm doing more of like a Western doctor and just like, take these pills, honey,
Right.
But it did help so many patients, and we did get amazing results with patents and acupuncture, so I do, I do encourage acupuncturists, even if you just want to go that route, the patents work really well. But do I consider myself like a, master Chinese herbalist? Of course not. It's really challenging to put a formula together. And, I don't know how many years we learn it in school, but it's just, just to figure out how much of what herb, it's so complex. It's so complex.
It's very complex.
Yeah.
And look, I'm going to be very rude now. Okay.
It's okay. You be you.
If you want to study, so I've got friends who are doctors, general practitioners, and they're really close friends, and I am in awe of their knowledge. They have studied for years and years and years, and they've studied really, 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 really hard. And when people come in to study medicine, it could be there could be an argument that before, so they're assessed. Are they actually suitable candidates to study medicine? And maybe that assessment probably is becoming broader. What are they like as people? Do they have empathy and that kind of thing? The first requirement really is they have to make sure they've got a really, really good brain, because it's you have to study so much, you have to remember so much. They're smart people. That's the thing. They're very, very smart. May not be completely rounded people, but they're very smart. Okay. So I think that level of intellectual competence is a requirement for studying herbal medicine. It's not a requirement for studying acupuncture, not really. There's quite a lot to remember. So I'd say a lot of people who come into the acupuncture profession are not that smart, or they're not smart in that way. They're smart, they're smart in different ways. They may be more.
Yes, they're smart in different ways. Exactly.
They're not necessarily smart in that way that allows them to study a vast amount of very complex material and apply it with great intelligence and so on.
Mm-hmm.
So it's another reason we shouldn't assume that all acupuncturists should learn herbs. It can be just really not the right people for that particular subject. And just one more thing that came to my mind, which is about dosage.
Yeah. Super hard.
The way I studied herbs, the way I practiced herbs, all the people that I observed in China, in Britain, the people that I worked with on editing work, they use substantial doses of herbs. They're giving 150 grams, 200 grams a day of loose herbs. And so I think there's been a trend for various reasons. One of them is cost, and one of them is lack of confidence, and one of them is I don't want to risk doing any wrong, to go down to very low doses, which in my reduces the effectiveness of the herbs. It makes it just like, oh, at least I'm not going to cause any harm, even if I don't quite know what I'm doing. That's not exploring herbal medicine to its true best. I mean, it's true there are people who make arguments that low doses are as effective as high doses. I don't buy that, but let's.
I don't either.
That is an opinion, and I wouldn't like to scoff at it. But I think the reason most people give low doses is because they don't really know what they're doing and they don't want to get it wrong. Yeah.
I mean, I would super up the dosages on the patents, and I would tell the patient that, listen, the only thing that I need you to focus on is taking the correct amount regularly, because if you don't get enough in you, it's not going to work. So that was like the one thing that I stressed with them. And then for me personally, I would say, listen, you really can't take too much with herbal medicine. The way that you can take too much, you'll notice, is if your stool gets loose. So if your stool gets loose, then let me know, and we need to adjust the dosage. But that really rarely happened, other than I think once when I gave a cold formula to someone that was cold. And then we learned really fast that was the wrong herbs. So that I remember. Yeah, that was a while ago. But it wasn't, didn't do any harm. It was quickly ended because it was like one dose and it didn't work. And I remember at that time, I think that was in the beginning of my practice, I even bought the herbs back from the patient because I felt super guilty.
Oh, okay.
Mm-hmm.
Talking about harm, I mean, there's one other thing that really should be mentioned. So one of my really good friends is Mazin Al-Kafaji, who runs a very, principally known as a now world-famous Chinese medicine dermatologist who runs a clinic just around the corner from me. So it's a very, very professional clinic in every way. So he blood tests all his patients at the beginning, after a few weeks, and periodically if they're having extensive treatment, primarily to check liver function because of idiosyncratic reactions to herbs. So one in 1,000 patients, or I don't know what the stats are, can suffer a really quite a dangerous idiosyncratic reaction to herbs. That can be really quite serious. So again, the stakes are higher. You're not mucking around. You can't really slip and slide with herbs if you're doing it properly.
Well, I mean, I think the fact of the matter is, this is us accepting and acknowledging the fact that we are doctors, and we are prescribing medicine. Even though it's herbs, it's still medicine. And it's the same as Western doctors. They're prescribing all these pharmaceuticals that do injure their patients sometimes, and even though we are holistic practitioners, we still have the ability to do the same thing, and it is to take our position, very seriously, as a doctor. And the fact that we are prescribing something that, there is some herbs that can do those kind of things to people for sure. And that's why too, again, it's so important to be in touch with your patient, especially when you prescribe herbs, check in with them and make sure everything is fine. It's just even after the first dosage with them or something.
Yeah.
Because it's medicine, for sure.
So bring it back to the topic.
Yeah.
Should all acupuncturists study herbs? The question is, you know, if an acupuncturist wants to study herbs, are they willing to take that on? Are they willing to take on the responsibility of being, as you say, like a doctor?
Yeah.
And the level of competence and knowledge and skill and information that requires if you're going to take that on. Otherwise, don't. I mean, if you want to be physiotherapists are not doctors. Psychotherapists are not doctors. I mean, you don't have to take on this massive responsibility, this massive level of knowledge if you don't want to. Be good at what you're good at.
Yes. Yeah, I agree. You know, someone doesn't want to, for sure. Like, I agree, don't at all feel like, you know, you are any less of a practitioner or, you know, judge yourself or you can't help patients or anything like that, because that is definitely not true. You know, acupuncture is incredible alone, for sure. I think the point that you made, I wanted to talk about some people just are smart in different ways. The thing with that, though, is, you know, how in the world is someone going to know if they are smart in the herbal way, you know, until they get into it?
Well, some of it's pretty straightforward. So if you go to school and you study, I'm in the UK, you know, if you go to school and at the age of 16, you start studying 2 years for what we call A-level, advanced levels, and you study a subject like history or mathematics or biology or stuff, you'll soon find out whether you've got the kind of brain that can study. You know, because you get good results. So, you know, one of the first things, if you want to apply to medical school, you have to have top results in your high school examinations. It's the same in the United States. That's a pretty good test. It's pretty basic. Can I study? Can I focus? Can I retain information? Do I understand what I'm reading? All that kind of thing.
Yeah, but they are not having that type of filtering with the acupuncture schools in the States.
Absolutely not. But it's partly historic because that's not how it was traditionally set up in China before the university system. I mean, it is so now, you know, you have to go to university to study acupuncture in China. So there are all those, I don't know the entry requirements, how strict they are, but it's also commercial. I mean, the colleges just want students. There are a lot of people in, you know, who perhaps, you know, no way would get into medical school. But, you know, and I'm just saying it's a fact. You would just have to understand. We perhaps don't necessarily want acupuncturists to be the kind of people who would. We don't not want them, but we don't expect them to be the kind of people who are able to get into medical school. We perhaps want different skills from them. Empathy, connection, palpatory skills, you know, body, whatever. I don't know, however you want to define it. So,
I mean, I think, yes, I think it's basically, we almost are saying the same thing then. Like, if someone wants to study herbs, go for it, but know that you are taking on a ginormous responsibility and it is a very serious medicine, you know. However, I have a little bit of the different opinion where it's like, you know, even though it is ginormous responsibility and a little bit of a huge thing, you know, if you want to and you study it and you do just want to go like patents and use the lighter ones, you know, do it, you know, because that, I think, it's still like, yes, you are not like a master herbologist, but it's still like helps patients so much.
I don't disagree with you, but in that case, what you need to do is have that level training for acupuncturists. You go, okay,
that's a good idea.
Level training for acupuncturists.
Yeah.
So it's not just patents, for example. It's external. medicines.
Yes. Yeah.
All acupuncturists should really use external treatments, pastes and liniments and
Yep.
whatever they are
Yeah.
for a whole range of problems, mostly musculoskeletal, but not. They're safe. Patents used cleverly safe. That's absolutely, if you define that level and schools teach it, that's great. So no argument. But so we just need to, it's a classification system. We kind of need to be clear what's expected from different levels of study and what's involved, and people make informed choices. But the worst thing is for an acupuncturist to feel, particularly if they've been misled in college that acupuncture is wonderful and can treat everything, and they're in practice and they think, actually, I'm trying to treat a chronic case of eczema and it's not really getting any better, or I'm trying to treat endometriosis and it's not getting better. So they think, it's not good enough, I'm not good enough, I've got to learn herbs. But perhaps they don't really want to learn herbs, or they're not really equipped to learn herbs. So rather than coming to the conclusion that I have to accept what the limits of acupuncture are, I'm very comfortably and happily work within those limits. And if somebody comes to me with a problem that I don't think acupuncture is suitable for, I refer them on. I mean, everybody should refer on. You shouldn't try and treat everything. It's ridiculous.
Yeah. No, absolutely. Because herbs work great for those situations. But if someone isn't an herbalist, that's a really good point for them to be aware of the fact that herbs is actually what that patient needs. And it's their duty to refer them to someone that is an herbalist, because that's going to help that patient so much. So that's a whole nother level and layer of things that we don't learn. We don't learn in school. I would say those are definitely two of the top. I mean, any gynecological thing responds really well with herbs. And sometimes, can be challenging with just acupuncture. Even just infertility. Herbs are so powerful for infertility.
Having just finished editing a massive textbook on the treatment of infertility,
exactly.
I would say acupuncturists are completely and utterly misinformed and utterly naive if they think that acupuncture can even begin to approach the power, complexity, and subtlety of really well-directed herbal medicine. And to go, I can treat, or it's all about knowing what's realistic. There are some issues with infertility that can be treated with acupuncture, and there's lots that doesn't stand a chance of treating. This is about knowledge. It's about accurate information rather than illusion and delusion. And I still suspect that most practitioners, most acupuncturists are not educated in that.
No, they don't talk about that anywhere in school. Nowhere in school. That's why we're having these conversations, so that there is some knowledge and somebody talking about this out there. That's there's so many layers to the schools. Yeah, there's so much, but that's a whole nother conversation.
It is another conversation.
That's another conversation.
Yeah. We love illusion. We love fantasy. We love the idea acupuncture can treat everything. We love the idea, or it's not just us. Right through, particularly complementary medicine.
Yeah. And we talked about this a little bit on one of our chats, but I've even been, I would say, guilty of saying, hey, listen, you can treat anything, but I wasn't specific enough, because for me, it was natural to know that, some patients don't get 100% better. Some patients do need herbs in order for this to work. It was just natural. I just knew that, but a lot of practitioners don't know that and don't understand that. And so when I say something like, hey, you can treat anything, then they think that, they're a failure, or they're not good enough, or they, what's wrong with them? So we do need to differentiate. And so a lot of things will work really only with herbs. And a lot of things, won't get 100% better, but you're still helping the patient, a lot. And things with chronic things, you help the patient really just to manage and maintain their symptoms and not progress any further.
Absolutely, as long as the contract is clear.
Exactly.
as long as you're able to say to a patient, look, acupuncture can may improve your energy, may help you feel better in yourself. This great saying from, is it relevant? Maybe Iyengar, the yoga teacher, I often refer to it. Yoga helps cure what need not be endured and endure what cannot be cured. So,
Love it.
it's true. I would have to adapt that. So acupuncture, it might be fair to say, look, I probably can't affect this disease with acupuncture, not significantly, but, there are benefits from having acupuncture treatment. And that's great and that's straightforward. But to kind of give the patient the illusion that if they come with, say, polycystic ovary syndrome, it's challenging to treat with herbs and may take months, that acupuncture is going to do it. I mean, I may be wrong. Maybe somebody's going to get back and go, wow, I cured polycystic ovary PCOS, but I think it's pretty unlikely. As long as the contract with the patient is clear,
yes,
great. Yes. If it's not, if it's we're acupuncturists, we treat the whole person, and that's code for I don't know what I'm talking about, in my opinion.
And it's a very valid point, and this is like what I help a lot of them with too, is like really communicating directly and clearly. And you've heard me lecture. That was something I lectured about that day, is that it is so vital that you are direct and brutally honest with your patient what it's going to take, for them to get better with the medicine. That's why giving someone, a treatment plan and continuing to communicate with them and all this stuff is so important, because it does a disservice to our patients, to the medicine, to your confidence and ability as a practitioner to have unrealistic and and even like the unrealistic expectations of the medicine, though, is sometimes just like a blind spot, So yes. Now that we're like getting into some, like, man, there's so much more.
I've got people coming into the office in a few minutes to start.
Yes.
As well.
Of course, we chatted for almost a whole hour.
Yeah. I don't know whether there's a kind of summary. I think we've kind of agreed. It's only slight blurring sometimes, but so my final position on this would be: we need more great herbalists, and I hope that any acupuncturist who's really drawn to study herbs and really knows what's involved, is really prepared to take the challenge. Please study herbs, because in the UK it's a fading profession. It's very few people studying Chinese herbs.
Oh, I didn't know that.
So that's really important. On the other hand, don't think that because you're an acupuncturist, there's some requirement or obligation to study herbs.
Yeah.
Especially if you don't feel you're equipped for it. And then finally recognize there's a middle way. Mm-hmm. So if you decide to stay as an acupuncturist, be a great acupuncturist. Yep. And if you do want to learn some herbs, but you don't want to do the whole thing, then become competent using patents and external treatments.
Yeah, absolutely. Because that is an excellent way. And, for schools that, you have to learn herbs. Don't learn them, but just because it's so confusing and complex, don't even use patents. Go for patents, So yes, we do agree. And I also agree that, the only way anybody's going to get any better is if they just try, but try with the awareness of it being a large responsibility as a doctor.
Yeah.
And take it seriously.
Yeah, take it seriously. Or take it all seriously.
Yes. Okay. This was a good conversation.
Yeah, it was a good conversation. Covered a lot of ground.
Yeah. So much to think about. So much. Like, there's always so many layers to our profession.
Yeah.
It's fascinating.
Yeah.
Okay. Well, this was an excellent conversation. Thank you for sharing all your knowledge and your experience, in China and all the hospitals and stuff. Really interesting. I had no idea that they were separate, herbalists and acupuncturists. So that's fascinating.
Yeah.
Yeah,
Good.
that alone.
So, well, you know, if we have a series of these, we'll solve all the problems with the
Yes.
yeah.
One conversation at a time.
Right. Yeah. Hopefully, when I'm in a better state of health. Yeah. But as I said, everybody in the UK,
I know.
everybody I know has gone down with these colds, and it's partly
It's stress. It's epidemic stress of what's going on. I'm not surprised.
partly depression about what's been happening here. So
You know, after Trump got elected, it brought in a ton of patients in everybody's acupuncture offices. So, acupuncturists, this is a great time to get your
Acupuncturist, vote Trump in again. Get more patients.
No, I mean in UK. In the UK, it's a great time to get new patients because everybody needs the support right now.
Absolutely.
Yeah. All right. Take care of yourself. Thank you for chatting when you're
Thanks anybody who ends up watching this.
And they'll watch the replay. Yeah. Okay. Bye.
Bye now.